I'm Dr. Juliette Breeze, founder and CEO of Next Level Urgent Care. Returning to work safely is a topic that has been front of mind for most business leaders and employees in our community. Before this pandemic, employers kind of left it up to employees to determine whether they felt healthy enough to work. But now, both employers and employees are looking at workplace health in a very different light. It is a fact that the health of an individual employee might affect the health of an entire workplace. And since it's unlikely that we're going to have a vaccine or a treatment before many of us will have to return to the workplace, we need to take steps to protect the health of employees and also reduce the stress and anxiety that's going to be associated with the return to the workplace for many. As employers, creating a well thought out return to work plan can not only ensure a safe environment, but also create a positive experience for employees who may be a little fearful about their return. So today, I'm going to cover many different aspects of workplace health safety and address the things that employers need to consider as they contemplate restarting on-site operations and returning their employees to the workplace. Let's start with the easy stuff. Workplace modifications that help distance employees one from another is a very easy concept for us to get our heads wrapped around. Evaluating the workplace and figuring out whether furniture can be moved apart, whether workstations can be separated, that is the first step. If that is not feasible, if it's not feasible to spread out, then the next thing to think about is whether you can reduce the number of employees in a workspace by staggering shifts, by continuing working from home, also addressing tight spaces like hallways, maybe setting up unidirectional flow for your employees. Many employers are using tape to mark on the floor that a certain hallway is only going in one direction. Other things that really help in the workplace in terms of separating employees from each other are signs. And this seems so simple, but reminder signage is very important because you're trying to limit the number of employees in bathrooms, in elevators, in break rooms. And this is going to be a little bit odd for employees, especially those who have been in the workplace for many years and have habits that you're going to be breaking with these new rules. Aside from distancing modifications, increasing workplace disinfection efforts is a really excellent step that can make it clear to employees that you are taking their protections seriously. It also, psychologically, it is very helpful because it gives employees a chance to participate in efforts to improve safety. Make sure that proper cleaning supplies are well stocked and they're very visible throughout the workplace. Every sink should have a full soap dispenser. There should be ample hand sanitizer. Many employers are planning to distribute hand sanitizers on a regular basis. Also, cleaning supplies, maybe things that employees don't usually use during their workday, but now you can provide them for employees to do things like wipe down the handles of a refrigerator or wipe down a door handle. Any kind of a sanitizing wipe of some sort would be fantastic to provide for employees so they can participate. For nightly cleanings, you want to make sure that your housekeeping service is maybe at an enhanced level and make that very public and known to your employees that the overnight cleanings are using enhanced disinfecting methods. Finally, remember to discourage workers from using other workers' phones, their desks, their offices, or depending on what kind of workplace you have, their work tools or their equipment when at all feasible. These next modifications are a little more involved. They require a commitment of time and effort, or they may involve facilities engineers, construction, or maintenance. This I categorize as engineering controls. So these might be things like installing high-efficiency air filters, increasing ventilation rates in work environments, installing physical barriers, like in this picture, this gentleman is working behind a clear plastic sneeze guard, and we're going to see a lot more of these in definitely in the retail spaces and places where they've got high customer flow through. Installing a drive-through window for customer service might be something that's feasible for some businesses. That's kind of a more in-depth control. And then finally, I mean, something that's actually a little more easy and maybe something that all of us could do is check out handless entry for doors. So if you've got doors at the workplace, there are these little brackets that you can basically put on the bottom of the door that allow you to pull it open or push it open with your foot. And those are really nifty and not very expensive. Now that you've made all of the reasonable and necessary efforts to modify your workplace for the returning employees, it's time to turn our attention to the employees themselves. First, you are going to have to determine what type of personal protection you want them to utilize. Once you've made that decision, the most important thing you can do is to ensure that employees understand what's expected of them and how to use the equipment you're going to be providing. So examples of personal protective equipment include things like gloves, goggles, face shields, and masks, which the masks come in a lot of varieties. Right now, most lay people or people who are not in healthcare are either using cloth masks or the procedure masks that are pictured in this slide. N95s are being reserved right now for healthcare workers. Therefore, your work team, if you're not in healthcare, you're probably going to be looking at those other types of masks. With respect to mask requirement, you really want to make sure that any orders that are in place for your city or municipality are being followed. But otherwise, employers can make the decision about whether they want asymptomatic workers to be wearing masks or only those with cough and cold symptoms. No matter what you decide on what your employees need to be wearing, the most important thing you can do is to show them how to properly put the equipment on, use it, and then how to take it off correctly. And we have noticed that many people in the community are wearing these things improperly. So employers will do themselves and their employees a great service if they can come up with a great communication method to train employees on the proper use of this equipment. We've found that videos are very effective. Next Level has produced a few videos for employers, and I do think that that seems to go over a little bit better than written instructions. But if you are going to do written instructions, make sure that, of course, the literacy level and the language is appropriate for the employees. So a few of the things we've discussed will definitely need to be written up as policy changes, specifically if you're going to be requiring masks or PPE when you didn't before. That should certainly be a new policy. But other policies that you may want to revisit before opening or reopening are things like sick leave. Many employers have had in the past a combination of paid time off for vacation and sick. So those kind of policies incentivize employees to stay at work when they're ill because they want to conserve their vacation time. So those are policies you probably want to revise. The other thing that you want to look at is your return to work policies. Specifically, many employers require a doctor's note to verify illness or to return to work. And frankly, right now with the recent changes in healthcare, employees may have a hard time getting those notes, and you certainly don't want to put roadblocks up for employees in terms of being absent when they're ill. So that may need to be temporarily changed. The other policy to look at is workplace visitors. So if you have a current policy on workplace visitors, It may not include limitations to the numbers of visitors per day. And you may want to also take a look and include whether you expect the visitor to participate in screening prior to entering your facility. So that brings us to screening. Because COVID-19 represents a direct threat to the safety of employees in the workplace, as employers right now, we are allowed to require that our employees be screened or tested prior to entering or re-entering the workplace. At Next Level, we're currently providing screening for several organizations around Houston, and this slide is an example of an application we utilize to check in employees as they arrive to work. The questions can be customized to suit the employer's needs, and as employers, we can ask COVID-19 symptom related questions or exposure related questions. Remember that you should handle the employee's responses as a confidential medical record. So that means that responses and data should be maintained in a separate confidential medical file and limit the access of that file to those with a business need to know. So if you're going to do any kind of more in-depth screening like this, you're definitely going to want to keep that very confidential. Now let's talk about the kinds of data that you can collect on patients. Many employers are requesting temperature checks on entry. This is best accomplished with a touchless thermometer, and the employer can set the parameters. Medically, we regard 100.4 as a fever, but normal is 98.6, and some employers have asked us to fudge down a little bit so that there's a slightly lower set point. That way they can catch employees that are beginning to be febrile. Another data point that some employers are gathering is pulse oximetry. Recently, it's come to light that COVID positive patients may have something called silent hypoxia. That means that they don't even realize that they're having low oxygenation. They may not have a cough or shortness of breath, but their pulse ox reading will read maybe in the 70s or 80s, where normal is 94 to 100. So here are just some words of caution about both of these types of tests. First, with the body temperature, not all people who are positive for COVID-19 and who are shedding virus actually have fevers. It certainly is a common symptom, and so for that reason, it's a reasonable screening tool. But something that's very important in Houston is that many employers initially started taking temperatures outside of the building. Well, as temperatures in Houston begin to rise, we may have more employees that are sort of overheating and hitting those temperature set points. So you may want to decide to test either in a foyer or some sort of air-conditioned area, or maybe a tent with a fan, something like that. And finally, on the thermometers, make sure that they are calibrated. We have seen some workplaces that were using thermometers that just weren't actually reading accurately, and that's really kind of a waste of everybody's time. On pulse oximetry, the only thing I want to say is that there is a chance that this testing will pick up people who actually have underlying conditions that aren't related to COVID, but may result in more medical treatment. So if a person registers below a 93 on the pulse ox, the recommendation would be to see a clinician for, at the minimum, an examination and a chest x-ray, but probably we would want to COVID test that person. And then if all of those things made it seem like they were not a COVID positive patient, they would have to get further evaluation for what the cause of their hypoxia. Another word about screening in general is that you should make a make sure you have a good plan in place on what to do if an employee actually fails the screening. Should they be sent directly to their car? Should they be placed in an isolation room where they can talk with their supervisor? Do they go home, or do they go for testing? All of those things have to be addressed, and specific policies need to be in place before you start doing these kind of screening and testing. Now let's talk about my very least favorite topic, which is testing. As many of you may know, testing in this country has not been readily available to many. As employers contemplate returning their workforce to work, many of us want to include a negative COVID test as an initial requirement. Well, this can be done, but it cannot be done through insurance right now. The insurance does not seem to be paying for asymptomatic people to be tested. So this would be at the employer's expense. There are two types of testing options out there right now, and I wanted to talk about both of them. The first one is called PCR, and it's really the gold standard for active disease. It generally involves the nasal swab, as is in the picture here. And these tests are highly sensitive and specific for viral shedding, so a positive should be believed. Now, the other test that everyone's talking about is the antibody testing. Most medical professionals don't believe that this test should be relied upon solely until further studies have been performed. Currently, the FDA is recommending that all antibody testing be followed up with a PCR test if it's positive for the IgM, which is a marker for active infection. And they've stated that the presence of IgG is not necessarily indicative of immunity. Despite these statements from the FDA, there is a flood of this type of testing available, and many employers have decided to use it in combination with other screening tools to help them determine whether it's whether it's safe for a particular employee to return to work. As you can see, there are a lot of decisions that employers will need to make as America reopens for business. Almost more important than the individual decisions that you make is the way that you communicate those decisions. Let's face it, there is a lot of emotion out there, and most of it is not the good kind. People are scared, they are anxious, they're depressed, and they're very distrustful. So honest communication about what you've decided and why will help address and hopefully allay the fears of your employees. You're going to need to develop a communication plan, and that, of course, you'll have to address the type of communication, the frequency of communication. Make sure that you are, in your own opinion, over communicating. You cannot communicate enough, especially in these kind of times. I personally have sent out a nightly email since the pandemic began. My email is very short. It only addresses 1 or 2 points each night, but I try to use that time to myth bust, to address the rumor mill, and always express my gratitude for my staff's flexibility and willingness to adapt to daily changes. So, choose your weapon and then use it often. Informed workers who feel safe at work are less likely to be unnecessarily absent, of course. And if you can try to include internet-based forums for answering some of your workers' concerns. We held a few large-scale conference calls where people could express themselves, and that seemed to bring down the panic level substantially. You definitely have to be ready for those because sometimes some hard issues come up, but I think in general, I saw that people's ability to express themselves really just made them feel a little bit better and a little bit safer in the process. One other point on communications revolves around the issue of telling workers if a coworker is positive. You definitely should let people know if it is likely that they have been exposed to a infected individual. And that's basically in order to ensure that employees are doing a good job of self-monitoring and making sure that they don't then subsequently develop symptoms. However, you should never reveal the identity of the individual, even if the workplace is very small and it's obvious who that person is. Don't mention names. So at this point, you are probably sitting there thinking, this seems like a lot of work. So when is this going to end? Not a day goes by that someone doesn't ask me for my prediction on how this is all going to play out. A friend of mine shared with me this Morgan Stanley research forecast, and I, in general, tend to agree with it. It shows us getting down to hardly any cases by about mid-August, but possibly seeing a resurgence in November and through the winter. In my opinion, if no treatments or vaccines are available yet, that resurgence combined with our regular cold and flu season may be even worse than the original event. That's why I think it's really important for employers to think about workplace health and safety, not in terms of what you're going to do for a few weeks, but what long-term solutions you may want to consider. Before ending, I do want to mention that there are many solutions out there for companies who want to provide additional healthcare resources for their employees, or who just want to understand what options exist for more healthcare, robust healthcare solutions. It's really a whole separate talk, but I thought I would just mention some of the possible direct services that some employers are taking advantage of for their employees to mitigate healthcare costs and to improve the overall health of their employee population. So the first one is really generally for larger employers, and that would be the on-site health clinic. On-site healthcare is generally free to employees, and in the no cost really encourages regular and consistent healthcare, since there's just no barrier for the employee to utilize the clinic. For employers that have less than 1,000 employees, or frankly, even for the larger employers, options like virtual medicine or telehealth, we call it, alone or in combination with near-site healthcare can be a great answer. So telehealth provides excellent access, but it is a little more limited in what types of things can be treated. Near-site clinics are clinics that an employer pays for as a direct subscription, and their employees can use those clinics for very low or no copay, and that also is an effort to improve access to care for an employee population. And finally, on the direct visits, you can also for maybe employers that have lower numbers of employees or have very high deductible plans, they can pre-purchase bundles of office visits at discount pricing and provide those visits to employees who need them. And I would be remiss not to mention mental health. With all of the things that have gone on, I think this is even going to be a more important healthcare offering that employers are going to start to offer regularly to their employees. We at Next Level, we do have a mental health product. We support employees through webinars, through video blogs, and also one-on-one mental wellness coaching. Those are the kind of things that I think more and more employers are going to be looking at after this pandemic. I think the overall health of the workforce is going to be much more of a primary concern. I hope this presentation has been useful. If you do have questions or would like more information about anything, you can email me at this email address on the slide. And also feel free to visit us at our website, nextlevelurgentcare.com.